Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Good evening, dear friends. This is Jessila Mujib welcoming you to a brand new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. This is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we will be discussing about GERD and acid reflux. GERD is a chronic condition that disrupts our sleep, appetite and other life activities. But with the right awareness, medical support and lifestyle changes, we can manage this condition. And the doctor joining us today is Dr. Reshmi Dhanukha from Al Hilal Hospital, Adaliya branch. She is a senior general physician with an experience of more than 29 years. So, doctor, welcome to the show.
Thank you for having me here.
And thank you for joining us today.
Thank you.
So, doctor, our topic of discussion is GERD. And how is it different from acid reflux?
GERD is a gastroesophageal reflux disease. This happens when the food material, instead of going from the stomach to the intestine down, it goes in the wrong direction. It goes upwards to esophagus and mouth. Sometimes it will enter into nasopharynx and larynx, thereby affecting and causing inflammation in these areas. While an occasional acid reflux is only once or twice when the acid is reflecting, that is called as an acid reflux, whereas GERD is a chronic disease.
Okay. Now, can you explain about the symptoms of this condition?
Basically, the most important symptom is a heartburn. People do get confused with the heart problem, but it is nothing to do with the heart. It is a burning symptom in the chest. It gets precipitated with many factors, and the other things with the heartburn is nausea, vomiting, abdominal pain, discomfort. When the acid goes to mouth, it will cause sore throat and coughing. Sometimes it causes breathing problems also, along with the hoarseness of voice.
And doctor, we know that acid reflux is very common. So when should a person visit the doctor for this acid reflux?
When acid reflux is coming only once in a month or once in 2 months, it's okay, it can be treated by their own. But when it happens regularly and it's not getting controlled by the own natural tips, then you should visit your healthcare professional to know better about this condition.
Can GERD occur in children or is it an adult condition?
No, GERD can occur in children. It can occur in any age, and especially nowadays, the children, because of their eating habits, they are eating junk food, processed food, carbonated drinks, so it occurs in more in them. And also the physical activity these days is decreasing. They are more into screens. That is why it gets more into children these days.
Now, what are the common causes of this condition?
There are so many causes for the GERD. Basically, it depends on the food. If you're eating hot, spicy, chili food, it will increase the symptoms. The basic 3 C's are there: chili, cheese, and chocolate, which should be avoided. Even in the drinks, the carbonated drinks, caffeinated drinks, and alcohol, these causes the GERD problem. Sometimes it is due to bacterial infection. The bacteria commonest is Helicobacter pylori. It also gets affected when the activity is less and a person is taking more large-sized portions. So those things will cause GERD problem.
Doctor, can you explain the connection between stress and this acid reflux?
Stress, there are different ways of stress. It can be positive or negative stress. And usually, like positive stress when a person is getting married or there is pregnancy, delivery, this is called as positive stress. And people get hungry, they tend to overeat. Otherwise, some stress, they don't eat. Both the cases will cause GERD. Overeating and large portions eating, and especially in the night time, it will increase the acid symptoms. If you don't eat for a long time, again the acid gets collected and it is not balanced with the other food. So both cases of stress will cause the increase in GERD chances.
Doctor, if we have some mild acid reflux, we just go for some home remedies. So how can we diagnose this is GERD or acid reflux? What are the tests to be done?
Yes. Acid reflux, if commonly treated with the home remedies, it can be corrected. But GERD, as it is a chronic disease, it will not go away with once or twice the home remedies. It has to be consistent with the home remedies. If it is not going with that, then we have to go to the healthcare professional who can take a detailed history about you, like what are the causes, what are you eating, what is your pattern of sleeping, how long you sleep, what are the daily activities you are doing. So this detailed history can help us to know the GERD. Even if after the history it's not coming, then the doctors usually give one of the medicine which is called as PPI. It is called as PPI trial. And if the symptoms subside with that, then you are knowing that it is a GERD. Even sometimes you have to go for biopsy through endoscopy. So these are the things which will help us confirm it is GERD.
Now you mentioned about stress causing acid reflux. Is there a connection between obesity and this condition?
Obesity, the usual causes are a person is eating large-sized meal and not doing too much of physical activities. If the physical activity is less and food taken is more, the digestion process gets disturbed, and food, if not getting digested, it will get accumulated. The accumulated food might cause infection, and this is the reason why it is increasing in obese persons. So you have to go for physical exercise and eat your food in small portions. That will help you.
And doctor, what about the treatment options of this GERD?
First of all, we should go for natural treatment, the home remedies, which includes you have to change your food pattern, you have to stop smoking, alcohol, caffeinated drinks, and in foods you have to decrease your citrus fruits, tomatoes, chilies, cheese, chocolate. You can go for more of green vegetables and fruits like banana. These will help you. You can go for yogurt and leban instead of taking milk, tea and coffee. You can go for more of berries. These things will help you. The second is the exercise. You have to keep on doing exercise. And it is said the kids who are doing every day 1 hour of exercise, they will tend to treat themselves without going to a doctor also.
And many people are of the habit of taking antacids for this acid reflux. So do they cause harm in the long run?
Yes. Antacids, they give a quick relief, but there is a hidden danger. The antacids, usually what they do is only they neutralize the acid. Acid is there, but antacid, they have the alkaline content, and so the acid is neutralized. That causes decrease in the calcium absorption, decrease in vitamin B12 absorption, so it causes deficiency of calcium, vitamin B12, it causes bone problem, kidney problem. So in a way, it is causing lot of risk factors more rather than improving, because it's only the immediate relief. In long term, it's not useful.
Now, can you suggest some lifestyle changes to manage this condition?
Yeah. First of all, we should change our eating pattern. Instead of eating one large meal, you should go for smaller meals. After eating the meal, you should never lie down. The sleeping time should be at least 3 hours after the last eating, and during the sleep, if you can raise your head end by 4 to 6 inches, usually the wedges are available in market, you can use that. The more you are in upright position, the symptoms will decrease. And if you are eating in a small portions with a healthy meal, more of like you can chew fennel seeds after dinner, you can go for moringa, you can go for turmeric. These all type of things that will decrease your symptoms. Go for more physical activity, and the sleeping should be, at least 3 to 4 hours after the last food.
Doctor, now can you speak about the complications of GERD?
Yeah. GERD, basically it happens because of the sphincter weakening, the gastroesophageal sphincter, which controls the movement of the food. This becomes weakened. This is made up of muscle, and the muscle lining becomes weak. Sometimes due to collected acid, there is erosion of the lining of stomach, and it might change to ulcer, what we commonly say peptic ulcer or peptic ulcer disease. This might cause the gastroesophageal bleeding, and the people might see there is blood in the stool or blood in the vomit. So this case is, again, it is of high concern. You should visit your doctor immediately if you see this. There can be gastrointestinal perforation, which might lead to anemia. There is blood loss, and patient usually feels very weak and lethargic. In rare cases, it may turn into cancer also. So the right time diagnosis and reaching the healthcare professional is a very important thing.
And finally, doctor, what is your takeaway message for our viewers?
Yeah, so basically GERD, it's a chronic disease. It happens in a long term. When a person is used to the same habit for a long time, it is happening. So you have to be consistent in your practice. If you are eating the things, you have to maintain yourself that you enjoy your treats, but you have to decode them first. What you are eating, be careful about that. Go for more healthier options, more water intake. Avoid high gluten-rich food, avoid caffeinated drinks, avoid the dairy products, and go for more fruits and green leafy vegetables. Make yourself active, do some physical exercise every day, and sleep after eating food at least 3 hours, and sleeping should be in a head end should be raised position. All these things, if done regularly, will definitely help you. Hope these tips are useful for you.
Doctor, this condition, GERD, will it increase during pregnancy, and how can they manage? Can you give some suggestions?
Yes. Pregnancy, usually it is associated with nausea and vomiting. The lady, she won't like to eat everything, and whatever she likes, if she's eating in a big portion again, if she is feeling to eat something spicy, there is more chance. So she can eat spicy food, but should balance with something more healthy, like after eating a spicy chili food, she can go for Leban. That will balance her conditions for the acid symptoms. So these are the things she should take care of the food. And with every meal, she should do little bit of walking. Because in the pregnant ladies, the space in the stomach is less and the food absorption decreases. The food, when it gets collected for a long time, again it will produce the toxins. So this food has to be eliminated faster. So she has to eat small portions frequently, along with some liquids, like lot of water intake should be done. That will help her again.
Thank you, doctor. Thank you for joining us today, and this is a very relevant topic, and thank you for giving us a lot of valuable information about this topic.
Thank you for inviting me.
So viewers, I hope this was a very informative episode and you got all the relevant information regarding GERD and acid reflux. For more informative episodes, tune into BMC Global Live every Tuesdays at 8 p.m. Till we meet again next week with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.